السلام عليكم ورحمة الله وبركاته. Uh, I came again with a new video. It's about counseling station. The topic is Kawasaki disease. This is Dr. Zaid, and we will be seeing the demonstration of the counseling station for Kawasaki disease in a pediatric Arab board OSCE. Let's start. Bismillah. So the candidate is waiting outside the station room. He will be waiting for 2 minutes, and in these 2 minutes there will be the scenario. He can read it, and he can know about the task. So I will read for you the scenario. Salim is a 16-month-old baby boy, had fever for 10 days, skin rash and neck swelling, had been diagnosed by evaluating team as Kawasaki disease. Laboratory evaluation done along with the echocardiography, which shows dilatation of the left coronary artery, small aneurysm. The task is counsel concerned parents about their baby clinical diagnosis and management. So let's start. Inside the station, you will enter. Remember, you have only 10 minutes to finish the station. There is physical examiner and online examiner and the surrogate parent. You will be starting by introducing yourself. So you will say, Salam, I am Dr. Fulan. I am one of the children doctor taking care of your son, and make sure that she is the mother. Ask her, are you mother of Salim? She will say yes. How do you like me to address you? She will reply by I am Salim, for example. Then explore how much she knows about the problem and set the agenda. Very important to set the agenda. Tell her that I'll be telling you about your son diagnosis and explaining to you the cause and the diagnosis and the treatment and the prognosis for that. So you must set the agenda for the mother. Moving to the next. Here expect that maybe the surrogate will be asking you and interrupting you. If she did not interrupt you, just volunteer with the information. Okay, so what is Kawasaki disease? Explain that Kawasaki is the leading cause of acquired heart disease in children. It is a vasculitis with a problem with the coronary arteries, and approximately 25% of untreated patients experience coronary artery abnormalities, including aneurysms. And do not say jargon. So every time you are mentioning a jargon, for example, you mentioned aneurysm, just immediately after seeing the vocabulary, which is a jargon, just say aneurysm, which is meaning dilatation of the blood pipe, for example. Okay. Then it is expected that the surrogate mother will ask you what is the cause. You will answer here that the cause of Kawasaki disease is unknown, but certain clinical features support an infectious origin. Then the mother will ask you, are you sure about the diagnosis, doctor? I am very worried. And she will show that she is worried. So in this situation, you will be answering like this. You will explain to her that Kawasaki disease is diagnosed by the clinical picture. And we will be doing diagnostic investigation, but not for the diagnosis purpose, just to know about the condition of the patient. So we will order blood test. We are calling it CBC. We will order acute phase reactants, and we will order ultrasound for the tummy, okay, and we want to do a television picture for the heart. We are calling it echocardiography. Then the mother will ask you how you will solve the problem, doctor. What is the management plan? Or you can volunteer immediately with the management plan. Explain the treatment, that what type we are using and what duration. Explain that we are using intravenous gamma globulin, the dose 2 gram per kg, and a high dose of aspirin for the heart. So we will be using 80 milligram per kg per day as soon as possible after the diagnosis. Very important, this sentence. We must start immediately as soon as possible after the diagnosis. Why? To prevent more coronary artery damage. The dose of aspirin is usually decreased from anti-inflammatory to antithrombotic dose, which is 5 milligram per kg per day after the patient has been afebrile for 2 days. Explain the benefit of each treatment. Explain that aneurysms will be like decreased by 20% if using aspirin, and it will be decreased by 4% only if we are using the IVIG and the aspirin. Then the mother, or you can add, is there anything else can help the patient? Yes, you will mention about the vaccinations. Explain the type of vaccination needed if long-term aspirin therapy is considered, the animal influenza and the varicella vaccine. And explain to the mother that if the child took the varicella vaccine, we must change the aspirin to another antiplatelet for 6 weeks. And moreover, if the patient received immunoglobulin, defer life attenuated vaccination for 11 months. These 3 things you must mention to add more marks. Okay, so it is expected. The mother is asking about the prognosis. What will happen to my son? What will happen to my son in future? Prognosis for Kawasaki disease, majority returns to normal. 1 to 3% will recur, and the fatality is less than 1%. Small aneurysms most likely to regress. Overall, 50% will regress by 1 to 2 years. And at the end, thank the mother and offer her, if she wants to ask any future questions, she can approach you anytime, and offer for her also reading material and a website to read more. Okay, make sure that you are maintaining appropriate eye contact and body language. Plus, you are allowing the parent to express the feelings and allow the parent to ask a question, address the parent's concerns, and ask the parents about their understanding of the child's condition, avoid medical jargon, and maintain a good behavior throughout the counseling. So, because all of these are paid attention to and they are giving marks on them, and when the ring goes, just you need to go out of the station. The station is 10 minutes, and just a reminder, at the 7-minute there will be a ring, or they will knock at the door to tell you that there are 3 minutes left to end the station. And we reached to the end of the demonstration. Thank you very much to listening to me. I hope you will do well in the exam, and thank you very much.